Again, I'm John Fortier of the Bipartisan Policy Center, and we have a panel here today. Our first one, which I will very briefly introduce and get them going. We're going to hear from each for 5 to 7 minutes or so, and I know Maya MacGuineas is going to have to leave early, so if we have a question for her, we might sneak that in before she has to leave. I will start in the order in which they're going to speak. We have Philip Howard, who is the founder and chair of Common Good and the great convener of this session today. Maya MacGuineas is the president of the Committee for a Responsible Federal Budget and director of Fiscal Public Policy Program at the New America Foundation. Richard Buery is here, and he is the president and chief executive officer of the Children's Aid Society, an independent, not-for-profit organization established to serve the children of New York City. Julie Barnes, my colleague at the Bipartisan Policy Center, who directs our health policy program. And Alan Morrison, who is the Lerner Family Associate Dean for Public Interest and Public Service Law at the George Washington University Law School, and co-founder of the Public Citizen Litigation Group with Ralph Nader. So we'll turn to each, have some presentations, and take your questions. Phil.
Thank you, John. I thought Senator Warner was terrific, and like Don Elliott, I subscribed him to almost everything he said. And it's incredibly important to have leaders on the Hill to work on these issues. The only thing I regret, he's calling his regulatory program PAYGO. In England, it's one in, one out, OIOO, which could be called OI. And I thought that would be a much better way of sort of going about talking about how to clean out old law that isn't useful anymore. I thought what I'd do briefly is describe what I view as the 4 problems with old law, just to set the table a little more. The first is that it just piles up. And Congress sees its job as lawmaking, not law fixing. And one of the reasons it piles up, in my view, is structural. Our founders made it hard to pass a law with all the checks and balances and such, and they didn't actually consider that it would be much harder to repeal a law than to pass it, because once a law is enacted, it's surrounded by an army of special interests that doesn't want it taken away. So in order to change one word of a federal statute, you have to have a majority of Congress run a gauntlet of special interest. And so there is a significant structural issue that we need to address in order to deal with the piling up of law. The second is that all laws have unintended consequences. The more specific the law, the quicker the unintended consequences occur. There's one law which we would all probably agree with the purpose of, which is to provide education for special needs children, which was passed in the mid-1970s. Very important to do that. At this point, special education laws, though, have sort of ballooned out of control and consume over 20% of the total K-12 budget in this country. There's less than 0.5% for gifted children and almost nothing for pre-K education. Is this the right use of public education dollars? No one is even asking the question. There are many laws like this, unintended consequences. The third, it's obvious, and Maya will talk about this, government has limited resources. And the job of an elected representative is to make the really tragic trade-offs needed to allocate those limited resources. And if we pass laws that have unbounded obligations, in the case of Medicare and some others that Congress doesn't even vote upon, then we've effectively ceded democracy to whomever made that deal 30 or 40 years ago. So it's not entirely inaccurate that government is run by dead people. It's all of these requirements and obligations that were enacted that don't even come up often for a new vote. So what are we electing people for? Our parents or grandparents elected them. And now we're stuck with the consequences. And the last is that there's a lack of coherence. Our statutory and regulatory system is the opposite of a code. America has good laws. The Uniform Commercial Code is a very coherent system of commercial law. Other countries have codes. We don't have codes. We have something that, again, not too inaccurately, more closely resembles a junk pile. It's stuff that's piled up over the decades. You don't have to be a conservative to be sympathetic with Senator Cornyn's observation or when he found out that there are 42 separate programs dealing with teacher quality. No coherent system of government would do it that way. We would focus our attention on teacher quality and try to deal with that public goal, but you don't do it in 42 different programs. So to me, and we'll talk about this further, the solution is not a procedural change necessarily. I subscribed entirely to Senator Warner's idea that much of the problem here is cultural. We don't even have the idea that we're supposed to be fixing all these laws. So we have to change our public goals and public values, which is one of the reasons why BPC and we are hosting this forum. Ultimately, I think, though, we were at a point where we need a recodification. It's like a decade-long review where we try to make law work better, not to deregulate, but to make it work better, to make it serve our public goals today. And to me, there's another flaw in the system, which is if you stand back and you sort of ask in any area, can the person with responsibility actually make a sensible choice here? Can the person in charge of the budget actually, does he have authority, does she have authority to allocate the funds and balance the budget? Does the teacher have authority to run a classroom? Does the person with responsibility have the ability to make choices? And because of the accretion of law, in almost every area of public choice, the answer to that is no. We're ruled by all these words. And there are lots of sensible people trying to do the right thing by them, but they can't make the choices needed to run our society. And that's the reason why I think we need to focus more on this issue and get together towards not what both parties are talking about, deregulation, better government, more government. It's really making government work for the people. We can't do without it. We need the traffic cops. We need the oversight. But it's just not working. So that's my summary. On to Maya.
Good, thank you. I think I'll stay right here. And I am sorry that I'll have to leave a little bit early, but I was really interested to hear Senator Warner's remarks because I think he's on to a really important area. And I think that given the huge fiscal pressures that we have in this country and that we're going to have to change dramatically how we budget, how we raise taxes, how we spend, and our overall use of resources, I think there's going to be increased pressure on the regulatory budget to try to do things sort of under the radar. And I think increasing the oversight there is just as important as increasing the oversight on how we actually spend dollars. So I think it's something to get ahead of. And I'm really intrigued by the whole topic of this discussion. And it's not, to sort of echo what you said, it's not about being anti-government or anti-spending. It's about thinking about in what ways government has become ossified and stands in the way of our ability to do the things we need to do to respond to new threats, to new opportunities, and to basically be nimble enough to have government budgeting be setting and responding to priorities. And somewhere in between where we are as a country right now, which is putting programs in place 4, 5, 6 decades ago and building them in a way that they become so permanent you can't change them. And then on the other end of the spectrum, budgeting in 2-month increments like we appear to be doing now, somewhere in between there must be the right amount of time to add stability to the economy through how you budget, but also a chance to reassess what you're doing and ensuring that your priorities are being met in the right way. So the point I think I want to just think about, and I guess I'll tackle a big one, but it's the notion that we should have open-ended programs in our budget, that basically we have a huge swath of our budget, almost 2/3 of our budget, which actually isn't budgeted for. So automatic entitlement or mandatory programs that don't go through the appropriations process and don't have the same kind of oversight, but instead just grow, and in many ways are structured to grow automatically, reflects, I think, a very keen perception that if you build something into the budget that way in the entitlement mandatory area where it doesn't have to go through the appropriations process, it's more likely to stay there and become permanent. And when you are a supporter of the program, that's a great idea. And in fact, the biggest programs there, Social Security and Medicare, are programs most all of us are supporters of. But it does sort of de-level the playing field when we think about budgeting, how you trade off priorities, whether you're talking about pre-K education or something else. I think one of the most sort of head-nodding promises, but actually disturbing promises in the political arena right now, when we think about how we're going to change and fix the budget, is basically anybody who's looked at it knows and thought about what we have to do, they know every part of the budget has to be on the table. All programs have to be reviewed. This is something that in order to get our deficits and debt under control, it's going to take dealing with both the spending and the revenue side of the budget. But there's one political promise that always seems to last, and that's when we're talking about Social Security and Medicare, we can't talk about touching any benefits for anybody over 55. And that's kind of the one political promise that you get all politicians agreeing to. And my dad nods his head and says, that's good, Maya, you make sure that one stays in there. But the truth is, how did that become a more important promise than protecting all at-risk youth or any other priority that we might have? And the answer is because those are parts of programs that are on automatic pilot. And my suggestion is that we start budgeting in our budget, that no part of our budget actually be exempt from thinking about how much we're going to spend in resources, what the priorities are, what the metrics of success are, something we were talking about in the previous panel, evaluating how they're working, and if indeed there are things that we want to keep in the budget, ensuring that they're paid for. But I don't think there should be separate parts of the budget where you put something, and key to this is that it's intergenerational, right? You contribute to it while you're working, and then you take out of it when you're a retiree. Well, a lot of the premises have changed since then. When we started many of these programs, seniors were the poorest cohort. Now they're the wealthiest. Every generation was larger than the one that came before it. That's no longer the case. So many of the premises of these programs have also sort of crept away, eaten away at the structure of what made them sound before. So I think as we have to overhaul the budget, which we inevitably will, to deal with our fiscal challenges, it's also an opportunity to, on a deeper level, rethink our national priorities. Think about whether we're spending all our dollars in the right way. Should 25% of our budget be on retirement? Should almost a third be going to health care? Maybe yes, maybe no, but we should revisit those as we do with all other parts of the budget and make sure we put them on a more equal playing field. And I think the first key here is actually budgeting for all parts of the budget. So that's my crazy idea, have a budget for all parts of the budget.
To prove we're nimble and flexible, I know Maya needs to go. If we could take, if there's one question in the audience for Maya, we will put it to her and then we will resume the regular order.
All good.
All right?
All good. Okay, thank you.
By acclamation.
Yes.
Thank you.
Richard.
Good morning. So thank you very much for letting me be here. I appreciate it. I want to talk a little bit about how some of the things we've talked about today affect those of us working in the nonprofit social service sector, and to give a little a window in some of the real-world implications for my part of the world. Just a little context, the Children's Aid Society is a 150-year-old social service agency providing everything from early Head Start programs to homeless shelters, to college prep programs and foster care services. And we have about $70 million in public contracts as well as private money. So the way these things affect us are numerous. And I'm going to talk about three interrelated problems. One is around accountability, one is around innovation, and one is around the unintended effects of bureaucracy and how bureaucracies work together. So just on accountability, as I think you said very eloquently, accountability is critically important. And particularly in our work, we work with some of the most vulnerable citizens in very difficult circumstances. So it's very important that we have good laws and regulations because people are at very high risk of harm if we don't do our work well. But I think the problem is that we are held accountable, but we're held accountable largely for the wrong things. Generally, we're held accountable for inputs as opposed to outputs, as opposed to outcomes or results. In most cases, a government directs the details about how our service is to be delivered. It directs the cost of the service, and we're reimbursed based on pre-approved expenditures. But what instead I think government should be doing is defining the results, the outcomes it wants to see happen, and then leave it to those in the field to determine the best ways to do that with greater flexibility. So just a couple of discrete examples. We run several after-school programs in New York City. And generally what we're held accountable for are things like the amount of hours we're open, the child-staff ratios, average daily attendance. And those are things are important things. If you care about safety in the classroom of an after-school program, child-staff ratio is an important proxy to help you think about that. But the thing that we're not held accountable for is whether the children are more connected to school, whether they're healthier, whether they are doing better in school as a result of the intervention. We measure these inputs as opposed to measuring what you would expect to be the result of a quality program is. Another example are in Head Start programs. We're regulated and can be held accountable for things like where the first aid kit is on the shelf, but not about whether or not the classroom is actually safe, whether or not children are actually injured. Another example in this area is financial accountability. So we have to report on or are held accountable for how much of our spending is for programs, how much is for admin, things like IT and HR facilities. And we're penalized if our admin costs are too high. In fact, most government contracts, those admin costs are capped at a hard cap of 8% or 10%, or if you're lucky, 15%. But again, in this case, you're regulating the wrong thing. And if I operate a health clinic, we operate school-based health clinics. If we get our children healthy, we prevent illness. So we get kids to come to school because they can get treated for their asthma in the building. It shouldn't matter to you whether or not our admin costs are 20% of our budget, 30% of our budget, or 5% of our budget. What should matter is results of our work. And in fact, by squeezing administrative costs, you're often squeezing out the very things that drive a quality service. So again, we're measuring and we're regulating, but we're regulating the wrong thing, sort of these input measures. This leads to a second problem of innovation. Again, and the central problem here is that the people who pay for our service are, of course, different from the people who receive it. And most government contracts are restricted as to time and to purpose. So the restrictions on time mean that you have a year-long contract, you have to spend the money in the year. And this creates really bizarre incentive, because if you are able to find a way to deliver a service at a lower cost, you don't get to benefit from that efficiency. You either give the money back, or you find a way to spend it very quickly before the year runs out. It creates very perverse incentives. Similarly, restrictions on program, what you can spend the money on. We might have a contract, for example, to deliver a specific substance abuse curriculum. But if we feel that we have a better way of helping people in our program avoid substance abuse, we can't implement that program until we can convince a government entity, the payer, that it should be done a different way. Again, these things work together to stifle innovation. They're inefficient, and they don't reward excellence, because rather than having 100 nonprofits trying different approaches to solve a problem, what you have is 100 nonprofits doing things precisely the way that government directs them to. And David Brooks had a really interesting op-ed piece in the Times this morning talking about how technocratic rules applied to our sector have the perverse impact of limiting and decreasing the type of flexibility and variety that can lead to better results. And then the third thing I wanted to mention is the problem of inefficiency caused by overlapping or unintended bureaucracies. So just having two examples. Last year, the New York Comptroller's Office found that 92% of the contracts in New York State were approved late. And normally, because of the process involved in getting the contracts approved, you have to, every government agency for every contract is reviewing your tax returns, reviewing your insurance regulations. And the result of this is that nonprofit social service providers get paid very late. 66% of nonprofit providers in New York State every year take out loans to provide working capital as they wait for government reimbursement, and are never reimbursed for the interest that we accrue. So basically, the sector is giving the government interest-free loans. And this, again, has a devastating impact on the quality of service, because it means that providers, particularly those who can't get loans, are firing staff, reducing services, not because they don't have the contract, but because of the challenges involved in getting a contract approved and therefore getting paid on them. Another example of just so strange competing bureaucracies that exist. So one thing that happened in New York is we operate programs in public school buildings and public housing authorities. So city-owned, city-managed entities like the Department of Education of New York and the New York City Housing Authority. But a lot of early childhood and after-school programs are regulated by a different city entity, the Department of Health. So frequently what happened is we'll be running, you have a school that's open till January 30th, and then on till June 30th, and then on July 1st, we start running a summer camp there. Through June 30th, the school is fine. The Department of Education says the school is okay to run a program there. The same child on July 1st, the Department of Health says this building is not up to standards to run the summer program. Same kids, same structure the next day because of these competing bureaucracies. It happens all the time in our housing authorities too, where we operate again, early childhood program in a housing authority. We're having a problem right now. The housing authority facilities are in very significant disrepair, and therefore our license to operate child care program at the center is at risk, not because of anything we're doing, but because the same city is not able to fix the problem of that housing authority building. In quick conclusion, there's some ideas I'd love to share if we have time, but in quick conclusion, I just would say that, again, the problem is not in the idea of regulation. It's critical that our programs are regulated so that we can deliver services effectively. However, the regulations are in many ways just designed to the lowest common denominator. They're designed to minimize the risk of fraud. They're designed to minimize the risk of harm without looking at the costs of those things in terms of our ability to deliver effective and innovative service. So again, the issue is not no regulation, but I think how to regulate things smarter. And thanks for the time to talk to you.
Great. Julie?
Yes, John. Well, I think Philip Howard got us off to the right start by talking about making the government work for the people. And, you know, at the Bipartisan Policy Center, where I'm the Director of Health Policy, we are trying desperately to bring our group of leaders that are really the statesmen of our time, who harken back to a different era of cooperation and a smoky back room where they got deals done. And we try to bring these folks together and get some things done. And I think if you've been reading the news even a little, you realize we are just failing miserably. We are trying so hard, but this is a very difficult time, not the least of which in healthcare. You've probably heard the rumor that we have some problems in our healthcare system, and one of the reasons why our system is really struggling is these healthcare laws that regulate doctors, that regulate hospitals, that regulate insurers, that regulate medical devices, that regulate every part of the industries, every movement, that are really about regulating a healthcare system of a bygone era. I mean, a lot of these laws and regulations were designed for the Norman Rockwell paintings, you know, where we had office visits and hospitals, and there was really kind of limits to what healthcare could do. And we're no longer in that era. We now have a procedure for this and a lab test for that and 40 other lab tests for that same thing that you'll get at a different place down the street for the same condition from a different provider. And so we really are in this very complex, by design, healthcare system that has been regulated upon and regulated upon and regulated upon and changed. But really, it is about the fact that we are now on the brink of a new system, a new day, where we are moving away from this sort of volume-based care, fee-for-service, office visits, procedure-based payments, where we're moving toward really paying for value and coordinating care and looking more toward patient-centric care and what that really means. And that's a whole new shift of regulation. So many of our major healthcare laws come from the 1960s. in the 1970s. I mean, the two major federal health care programs that you heard Maya wants to put back onto the appropriations table instead of an entitlement program at Medicare and Medicaid are 1960s. ERISA, HMO, 1970s. I mean, we are talking about all of the laws that no longer really apply to what we're doing right now. I mean, as early as 1945, we had McCarran-Ferguson, which, you know, did a couple of different things, not the least of which try to protect insurance carriers from antitrust laws, but it was really about saying, states, you can regulate the business of insurance. Well, then 1970s, we had ERISA, which was mostly supposed to be about regulating pensions, but instead it said, well, if you're a really big employer and you self-insure, then you are not regulated by the states for under insurance laws. So we have these piling on of laws that were to fix a problem over here, and then several years down the road, we try to preempt it or exempt it in some way. And we've got an incredible history. There's this fantastic poster that I wish I had that has all of the litany of all of the laws that interact with all these fabulous acronyms that you can only have in the healthcare system, like COBRA and HIPAA and SGR and FDA and Stark and anti-kickback and so on and so forth. A great example, I used to be a HIPAA privacy lawyer, a great example of how healthcare is so regulated that the laws are just constantly in conflict is the HIPAA privacy law, which of course came out of the era of when the first major national health care reform during the Clinton administration didn't happen. And so there were all of these bills, Maternity and Newborn Act, Mental Health Parity, the Portability Act, but the privacy law came out of that that mid-1990s era of, oh my gosh, we have all these things to fix. So HIPAA was supposed to be about keeping personal health information private and secure. So when we exchange it, it can remain private and secure. So we have this big federal law, all this capital poured into, you know, making sure that all of these requirements and mandates are in place to keep this information private, unless a state has a more stringent than privacy law, in which case the state law reigns. And if you might imagine, if you are an insurance carrier, say United Healthcare or Kaiser Permanente, or a major multi-state hospital system like Ascension Healthcare with the largest Catholic hospital system in the country, you can imagine how that might cause the hiring of lots of lawyers. So I'm glad my kids' college's funds are paid for, because I was a HIPAA privacy lawyer, and that was a boondoggle, I have to say. Because really what we did is we sat down and we described the federal law, and then we described all of the 50 state laws that it conflicted with. So it really is just one example of the many, many ways that our healthcare system has all these myriad of laws that conflict. So, luckily, all this nonsense was cleared up last year when Congress passed that very simple 2,200-page bill called the Affordable Care Act. So we're fine now, and that's what you get in the health policy world for a joke. But this program, and I'll quit in a minute, is designed to complain just a bit about the laws that are making our world overly complicated and too costly and don't make any sense. And as a recovering attorney who runs a healthcare policy shop at a Bipartisan Policy Center, I have no shortage of complaints, but I'll just name three. Complaint number one, and this is my favorite, and it really always has been, is the fraud and abuse laws. We have fraud and abuse standards in the healthcare system that are the biggest barrier standing in the way of transforming our healthcare system. We want affordable, accountable, coordinated healthcare, and we're doing absolutely everything in our power to provide fraud and abuse laws to stand in the way of that. And let me give you two examples. The Stark Law prohibits referrals of Medicare patients by physicians for certain designated healthcare services to entities with which a physician has this financial relationship, right? They own some lab down the street. So this law tries to prevent that financial incentive from encouraging doctors to refer patients for unnecessary care just so they can get a little something, right, from down the street. The problem is that there are compensation arrangements that try to achieve quality and efficiency by having everything done all at once in the same coordinated care under the same umbrella of that one provider, but we are forbidding that from happening no matter what. Even if everyone agrees it's a good thing, it can't happen under certain contractual circumstances because of the Stark Law. Same thing with anti-kickback. There should be some safe harbor for this same sort of concept of you can't kick back to yourself when you prescribe something as a physician. You should have some sort of safe harbor for these clinical integrated programs, because we're trying to coordinate care and we're getting on our way by not allowing that to happen. Something I know that is near and dear to the heart of Philip Howard is medical malpractice laws. Wow, do we spend a lot of money? No one agrees on how much in defensive care. There's something between 55 billion, 200 billion, the numbers are tossed around about how much money we actually spend on physicians being nervous about lawsuits and therefore ordering every test under the sun. And then with the same condition, you go down to the next provider who you refer to and they run all the same tests because they don't trust the lab that the first guy did. We've all been through this personally. Here's a couple of examples of how much money defensive medicine is costing that I don't know about those other numbers and whether or not they're true, but here's a breakdown of what kinds of tests are being ordered that are part and parcel of this mindset of, oh, I better order it because if I don't, then what happens to me? 35% of diagnostic tests, 29% of lab tests, 19% of hospitalizations, 14% of prescriptions, and 8% of surgeries are being cited as the unnecessary set of care that are a result of defensive medicine. Kind of crazy. Complaint number 3, Medicare. Medicare. I don't have the same complaints that Maya might have, but what I do have is this ongoing beast that is the Medicare reimbursement system that is really the driver of all things in the private sector in terms of our payment system. It's about fee-for-service. It is about blessing how many people you can see in a day, doctor, and how many procedures you can provide, doctor, right? And it's really this sort of skewed version, and the best way of describing the skewed version is talking about the SGR, the Sustainable Growth Formula. That was, again, a 1990s era formula that tried to cap physician payments through this fee-for-service schedule that no longer makes any sense. And we blow through that cap every year, and every year, or every few months as it has been lately, Congress has to revise that so that providers for our Medicare program don't get this incredible hit. Last time it was something like 25% of a rate reduction if SGR was actually allowed to be implemented, which it really hasn't because it's so inappropriate for our time. So we really have to come up with some new regulations that make all of the old regulations either go away or just make a lot more sense for what we have, which is a completely new healthcare system.
Thank you, Julie. One of the things I love about the BPC is the director of the health project speaks fondly of smoke-filled rooms. So, yeah.
Yes.
Alan.
Hopefully without the smoke.
Yeah.
So I'd like to take a quick survey. All those in favor of burdensome regulations, please raise their hand. Who's in favor of excessive paperwork? And how about fraud and abuse? We got any takers for that? Or how about a law that's been in effect for 30 years, which has been in effect for 30 years, so we ought to keep it because it's worked well for 30 years, or because it's been in effect for 30 years, we should presume that it's useless and out of date and obsolete. So I'd like to quote from Justice Cardozo, who said, I'm going to modify a couple words in the middle, he said, it's a great principle of constitutional law, and I'm going to say regulatory reality, that is not susceptible of a comprehensive statement in an adjective. And so I want to worry a little bit about adjectives here, including the adjective obsolete. I want to be clear, I'm not in favor of all the bad things we've heard up here. I just want to have a few notes of caution before we go ahead and start to knock down everything. Let me talk a little bit about medical devices. It's a complicated statute. It was put in 1976 to deal with the problems arising out of the Dalkon Shield. And Congress created 3 categories of medical devices depending upon how much risk they put on the patient. And they set up 3 different ways in which the FDA could approve medical devices. And one of them was the so-called 510K devices, which are grandfathered, and you can put a new device on so long as it's done things similar to what happened in the past. And everybody seemed to think that that was working pretty well. Institute of Medicine did a study suggesting maybe it wasn't working so well. And then for those of you who've been following it, there's this little problem with the hip replacements, with metal on metal, that seemed to be following up two prior versions that seemed to have metal in them, but nobody took the time to figure out whether metal on metal operated differently than metal on bone. And we have a massive number of hip replacements that are going to have to happen now. Many, of course, are not going to be covered because the Supreme Court has said that the device manufacturers are exempt from the law, at least in some of these circumstances. Okay, so what do we say about that? Do we say that because these devices worked for a long time and there were no problems, we should take that law off the books? Or should we say, no, we haven't been able to prove a negative. We don't know what would have happened if that law had not been on the books, so we should keep it there. And if we take it off the books, which way do we go? Do we require everybody to go through the full hearing, or we have nothing at all, just let people go on the market? Philip talks about principles and why we should have principles and greater discretion. So let me just say two words, well, two letters actually, BP. All those who think that we had insufficient regulation of what was going on in the Gulf, and that the people in the Interior Department were cooperating and regulating generally enough, and that was enough, they ought to think a little bit about whether that's enough. Now, I don't mean to say that all detailed regulations are fine and good, but we just need to be a little careful about it. Then what do we do about people say, well, we have no proof that any of these regulations are working? Well, one area we do know that they're working, and that is automobile safety. If you look at the data over the last 40 years, the number of deaths and injuries from automobile crashes is enormously decreased, almost certainly due to a combination of regulations. Should we now go back and take off the books because they are obsolete? The regulations requiring seat belts, automatic bag systems. What about windshield, crash-proof windshields, crash-proof dashboards? Are they obsolete, and should we take the time and effort to take them off the books because they're now working perfectly well? Then we talk about being able to assess values. I liked what Richard said a moment ago about all the numbers and the measures that everybody has. It reminds me of Einstein's great statement in which he says, just because most things that count can't be counted, and most things you can count don't count. And that's really true of a lot of what we see going on. It's easy to have metrics that which you can count and show how many this and how many that. The question is, what is it doing? And that's a much harder question. So it's not that we shouldn't be counting. We should be thinking about how we're going to go about doing it. Now, let me make a couple other points. One is, in order to change a statute, or for that matter, to change a regulation, you have to reverse the process that you went through to put it in to begin with. We could change the Constitution so it's easier to repeal a law than it is to pass it. We could change the Administrative Procedure Act so that you could repeal any regulation you wanted without going through the process to do it in the first place. But most people think that probably wouldn't be a good idea, that it would take the thought out of it. And not only do we require thought, but we require time and money to put all of these changes in place. The REINS Act, which has been touted up on the Hill to prevent new regulations from going into effect, also would, I hasten to remind the supporters, also prevent old regulations from being taken out of effect unless they got approval from both houses of Congress and signed by the President. But even before we actually start taking regulations out of effect, we have to do what's probably the hardest job, which is to figure out which ones we want to target. If you target everything, you will target nothing. And so how do you go about even starting it? Well, you could look, for example, at the cost when the regulation went into effect. What are the major regulations, $100 million in cost? The trouble with that is that once the regulation is in effect, much of the costs are sunken, and you don't get the benefit from taking it out. So take a regulation like Sarbanes-Oxley. I am told that businesses spent huge amounts of money putting it into place. But now that it's there, if you repealed it, they're not going to change all their books around just because it's repealed unless they actually thought they were going to save money. So you've got an enormous problem, not just in Sarbanes-Oxley, but think about all the environmental regulations that are in place. Companies have spent the money. Perhaps they shouldn't have spent it to begin with, but is it worth it to go through all of this to take it out? And what does it mean to take it out? Are you going to leave nothing in its place or put something else in it as well? So let me make a suggestion. Instead of trying to solve all of the regulatory problems in the federal, state, and local governments, and I leave aside budget issues because it's not on the agenda today, why don't we start with something simple? Anything. I don't care. Philip talks about education. I'm perfectly willing to talk about education. Even more narrowly, I'm willing to talk about special education. And let's get some people together to focus on a narrow area and see if we can actually do something. And we can figure out how much it costs to do something and what it produces and how long it takes to make change and what are the best ways to make change. If we tried it on a small scale, I, as an incrementalist, think that we ought to do that and see if it works. And if it works, maybe we can learn something and maybe we can go on to bigger things. Thank you.
Great, thank you. We're going to try to get back on schedule here, so we'll have a very short question and answer session here. If you could hold up your hands. What I'm going to do is I'm going to take 2 questions. I'm going to take one here and one over there in the row, and I'm going to have you both ask the questions, combine them up, ask the panel, and then we'll wrap for the next session. Do we have a microphone? Yeah.
Alan, thank you for, I think, some of your provocative ideas on some of this, because this gets back to, I think, what you're talking about, Richard. And the question, I think, is, what is the unit of analysis? We've had some conversation about we need to take an enterprise approach. We need to do something sweeping that reaches across to simplify. And yet, that can cause the input problems. And then the next question is, well, then do we create some sort of waiver authority where somebody at the front line can combine things or waive things in order to get a result? And I think that the questions are a lot more nuanced, as Alan's suggesting. And I don't know whether the answer is to start small, or whether the answer is to start enterprise-wide, or whether the answer is to focus on waivers or something like that. I don't think we've sorted out quite the right approach, but I think we've raised a lot of important issues. So.
Can I
Why don't we take both questions? That way we'll have the whole panel can respond to.
My question is about cost-benefit analysis. I suppose if we asked the room who's in favor of cost-benefit analysis, we'd see every hand go up. But I think it's very hard. If it were easy, then we wouldn't have any regulations that cost more than they had benefit. And my question, maybe for you two, Alan and Julie, is it seems like there might be a bias in favor. It's easier to count the cost. We can count hours of paperwork. We can count the cost of, say, putting in scrubbers into smokestacks. The benefits are often harder to count, and we do have numbers for life years and so forth. But they may be more abstract things. And do you agree that the benefits can be harder to quantify? They can also be easier to inflate. There's a suggestion that EPA inflates its benefits. That the benefit numbers are easier to abuse, and so there might be a bias in favor of looking at costs and not benefits.
Okay, do we start small or big, unit of analysis and cost-benefit analysis? Why don't we start with Philip?
Yeah, both Richard and Alan suggested we need a system where, at least in some important degree, people can exercise their judgment on unquantifiable benefits. It's a judgment call. And I do think it requires a system that's different than what we think of as, quote, the rule of law for certain kinds of issues, that you have to have a judgment-based system. Don Elliott and I were discussing it half the night, last night. And my view, and have a system like choice and check, where someone has the presumptive authority to go in and look at Rich Buery's programs and say, they're really fantastic for doing the job, and then some independent person, also using their judgment, can check that and decide whether they agree with it or not. But it's not a, quote, metrics-driven system. It's not excluding metrics, but it's ultimately a judgment-based system. And we need to invent, in my view, some system for what looks like administration as opposed to takings of property or something that should be in the rule of law that allows people to use their judgment, because you just can't systematize it the way we've tried to do in this nightmare, this jungle of regulation we've created.
Anybody else on the panel like to take on either question?
Well, I just say, I don't think that all problems in all systems are created equally and that there's one answer to the way to deal with all those problems. I might be willing to let somebody check Richard's matters. I'm a little less willing to have people check massive new drugs or medical devices or BP's oil spill. And so that's why I think we need to particularize our analysis. As far as the cost benefit is concerned, I agree that both sides are very fuzzy. At one time, we did a study when I was a public citizen. We called it crosstown hypocrisy, and we compared what the companies were telling the agencies as to what they were costing, the new regulations were costing, and what they were telling the SEC and their investors as to how much it was going to cost, and how the earth was going to stop rotating and they were going to go out of business if they put this regulation into effect. And guess what? It didn't happen. So I think there's the difficulty is not only that it's people have a biases in favor of what their position is, but these are just very, very difficult things to measure. I mean, how do you even start with what a human life is worth? Yeah, I mean, there's lots of ways you could do it, but the problem is we can't reach agreement. That is, and there, I don't say that it's a bad idea to start with. I think you've got to do something along that line. Just have to accept what the limitations are.
So the big or small argument, enterprise versus waivers, is an excellent one for a healthcare system, because the problem with this country, as far as the healthcare system is concerned, is that we've got 50 states in the United States of America, as opposed to one country. So, we do some of these comparative studies where we celebrate, how some other country is working, or they're single payer, or there's something like single payer, and they've got a single, well, it's because they operate as a country. We operate as 50 states. And so as a result, it is very difficult to comply with or implement a federal law that then has to apply to 50 states. The best example is the Medicaid program. This is a federal-state cooperation moment that is not being particularly cooperative. And it is because all health care is local, and what is good for Mississippi is not necessarily good for Minnesota, and what will work in California will not work in Utah. So it's this kind of a constant fight with itself, whether or not we go local or we go big. And insurance exchanges and the Affordable Care Act is the next witness we have for 50 states versus, we're trying to have a federal law, and we're trying to shore up what states have not been able to do for themselves, handle the individual market and the small group market, which is what's rendering insurance unaffordable for these millions of people in this country. And we're having an awfully hard time because the federal agency is trying to help the states get these markets off the ground, and each state is giving them a different story about what they need and what they can and cannot do, and the agency is going, we can't do 50 different programs. Well, we might have to, because that's exactly what we're looking at with 50 different states. So it's a very difficult answer when it comes to the healthcare system about whether you go big or whether you have to have a series of sort of exceptions to a rule that doesn't fit for 50 different states. The measurement and accountability question is also something the healthcare system has been grappling with forever. I mean, there are some now really good tools, not that measurement is everything, but really good tools to prove whether or not something is working. And I mean, we've gone so far as to actually call an organization, that's the Accountable Care Organization, is now the new acronym of the Affordable Care Act. These ACOs, which may or may not be a panacea, but they are certainly an attempt to say what's working and how do you bring down costs, and how do you make sure that we're improving care at the end of the day and paying for value versus volume, and all these kinds of assessments that we are trying more and more to do in the healthcare system, but heretofore we've been absolutely miserable at.
Just a couple of reactions. I mean, I think one at the core of all of this is trust, right? Do we trust the administrator to make judgments about the quality of the program? Do you trust the program to deliver quality services for clients, whatever the case may be? And in many cases, there are real significant reasons not to trust, right? There are reasons not to trust BP. There's reason not to trust or to wonder if the Southern School District is going to discriminate against black students in the school district. So there are all these reasons to trust. And to not trust, which leads to a desire to drive through rules. And so that makes sense. I think what is important for me is, as we analyze the cost of the bad actors making bad decisions, we have to simultaneously consider the cost of the rules which may be there for a good reason, but which present costs. And I don't know that we always are judging both sides of the equation when we decide, in a particular instance, as Alan said, whether to have a rule here or not. And the other thing is about the cost of measurements. And in many cases in my world, we measure the things that we do because they're easy to measure. It's very easy to have a clicker and say how many kids enter the building. The cost of measuring the impact of their experience in the building is more complicated. And I would only say to that is that, although it's complicated, in many cases it's important to make progressive efforts to do the complicated and difficult work of measuring that impact. Because until we have higher standards of evidence of actual impact, we'll always be in this conundrum where in a system where it's difficult to trust people, you'll inevitably find yourself counting things only because you're trying to latch on to some way of judging, and you're going to be latching on to things that are not meaningful because it's the cheapest thing to keep track of.
And Richard, nobody ever gives you any money to do the kind of evaluation that you would like to do.
Never. But
Never
they all
in the
want it.
budget,
They
never
all
in the
want it,
budget.
But never.
Thank you to the panel, and we're going to go right into the next panel. Thank you.